just want to give a shout out to our educational sponsors for promoting and supporting our monthly speaker series that we do every month. Merck and Exact Sciences, our supporting sponsor. They have been absolutely wonderful in allowing us to continue to have conversations like cognitive decline surrounding chemo treatment or cancer treatment in general. So, we look forward to bringing more topics like this to you every month and continuing to build that library. As we always say, if there are particular topics that you're interested in learning more about, please share that with us because we're always looking for new discussions. We are interested in learning what you want to hear about and what you want to learn about. And so, as always, please feel free to share that with us. So with that being said, I'm going to stop sharing our screen and I will put myself on speaker view as we go through a little bit of housekeeping. I'll keep letting our people in. So for the evening, some housekeeping as we normally do with our speaker series. So number one, I want to welcome everyone for being here. We have a fantastic group so far, and I anticipate more hopping on as we get started. Just a reminder to continue to mute yourself as we go through the presentation, especially as Rita and Erica get started, just so there's no distractions to the speaker and to other attendees. Once we start the presentation, we'll have Erica continue to move through. You're welcome to add some questions into the chat. I will be monitoring the chat for her as she moves through. We'll save most of those questions for the end because there'll be 15 minutes or so that we'll be able to go through those questions and have a little bit more discussion with the group. Certainly, if there's anything that jumps out that I think is really worth discussing during her presentation, I'll bring that to her attention. But again, feel free to comment and add questions as we move through. We'll be able to come back to them at the end. As you know, we're recording this and we will have it posted on our Her library in the next couple days. So you'll be able to come back and just sort of review the information that you're hearing this evening. We'll be posting some other resources from Revital Cancer Rehab. So know that that will be on our Her library. I'll also be posting that in the chat if you want to save that on your own as we go through the presentation. Just one quick reminder before we get going that, as I mentioned, we do these speaker series every month. So just to think ahead for the month of April, I can't believe we're already kind of getting into the spring with these, but our next speaker series will take place on Thursday, April 2nd at 6 p.m. Eastern time. We're focusing on clinical trials, and we'll have Ricky Fairley with us from Touch BBCA, and she'll be discussing her new program, When We Trial. We know Ricky does a lot of work with triple-negative breast cancer, but we'll be talking about clinical trials in that realm. One other shameless plug, this week has been filled with virtual events that we've been hosting. Some of you I saw last night at our virtual hangout. To wrap up the week, we will be having our Ask the Experts tomorrow with a genetic counselor from Penn, just coming on to answer some of those most frequently asked questions surrounding genetics and genetic testing. That will be streaming live over Facebook at 1 p.m. Eastern time tomorrow, Friday. So no need to register for that. If you follow us on Facebook, Unite for Her, just hop on around 1 o'clock tomorrow and you'll see us chatting. So that's going on tomorrow, Friday. So with that being said, did you say April? Yes. Yep. Our speaker series around clinical trials will be in April. It's Thursday, April 7th. I'm sorry, not 2nd, 7th. Thank you, Allison. 6 p.m. Eastern time. Again, as always, we're recording, so that will be part of our Her library as well. All right. Without further ado, because I know most of you are really interested in getting going, I first want to bring on Rita Pedare. She is in our local Westchester community. For those of us that are in our local program, she is part of the Revital Cancer Rehab. She's actually the program director for the Southeastern Pennsylvania region. She's also a certified cancer specialist. And if you are not aware, the Revital Cancer Rehab program treats patients from diagnosis to survivorship and helps patients navigate side effects of treatment, improving their quality of life. Rita has been in the Westchester area for the past 10 years, and she is part of not only mentoring and educating other clinical staff, but she is super well versed and has a ton of experience that she's able to bring to her patients. So just to share a few words about the work that she does, Rita, why don't I bring you on?
Well, thank you so much, Erin. That was a wonderful introduction. Actually, that is very true. I have been a physical therapist for about 20 years. And July 2021, when I was asked to lead this program, I was overjoyed. And now that I'm in this program, I can say people like Melissa have been helping. It's just such a pleasure to be here. The Revital Cancer Program is a comprehensive program, and we offer services like physical therapy, occupational therapy. At our Phoenixville location, we actually offer cognitive rehab. And we are now in about 25 locations and have about 30 clinicians certified in cancer rehab. So I don't want to take up too much space or time, but feel free to reach out to me individually if you guys have any question about cancer rehab. In the past, we have done a presentation of on the HER series for the benefits of cancer rehab, and also been a part of the cancer-related fatigue program. So feel free to check those out. And I'm also really excited to learn from Erica today.
Thank you so much. Wonderful. Yeah, there's so many great resources through Revital Cancer Rehab. So I'll be sure to plug their website in the chat. So if you're interested, you can hop onto that as well. I know we have attendees from all across the country, and they have locations nationwide. So you can see if there's a location in your area. So before I get into the introduction, I'll bring Erica onto the screen with me, and I will share a little bit about our expert for this evening. So Erica Guardascione, I think I did that pretty well.
You did it. Congratulations.
Step one. She is a speech language pathologist at Kessler Institute of Rehabilitation. She is a speech language pathologist, and she has a deep interest in the cancer-related cognitive decline, what we are calling CRCD. She is considered an authority on attention, focus, memory impairments, and rehabilitation strategies. She also serves as a curriculum developer and faculty member for the Revital Cancer Rehab Program, and practiced for more than a decade as a clinical specialist in the cognitive rehab program at Kessler, where she currently serves as the clinical lead. She holds an undergraduate degree in speech language pathology from Hofstra University and went on to pursue graduate studies for this specialty at Nova Southeastern University. So without further ado, please help me welcome Erica, our expert for this evening.
Thank you so much, Erin. I'm just pulling up my PowerPoint for all of you. Thank you so much for having me. I am very passionate about talking about cancer-related cognitive decline. Like Erin said, I think there's so many survivors out there who are dealing with cognitive issues. I think it's underplayed and not enough attention is brought to it. So anytime I get the opportunity to speak with any group and work with patients, I find it a privilege to be a part of it. So I'm happy to be here, and thank you for having me. So as Erin said, I am a speech language pathologist. I have been working in cognitive rehabilitation for about 14 years now. I work in our cognitive rehab program at Kessler Institute, where I work with patients with traumatic brain injury, stroke, brain tumor, and patients with CRCD, and now more recently, also patients with COVID. So we're seeing some cognitive impairments with patients with COVID, and we'll talk a little bit about some of the similarities there as well as we're rolling through. Again, very excited to be here. So before I start, I did, Erin already said I was going to we're going to work your brain today. So I thought the best way to get started is to start with a cognitive activity. So to prime your brains and get you ready for all this information that's coming your way, what I want you to do is I'm going to give you about a minute, and you have 10 words up on the screen here. So I know it's late in the day for some of you, and fatigue is there, but I want you to do your best to try and remember these 10 words And then at the end of the presentation, we're going to see how well you did with remembering these 10 words. So you cannot write them down, although that's a wonderful strategy, and we'll talk about strategies. In this case, I want you to do your best internally to try and remember these 10 words. So I'm going to go ahead and give you a minute. I'll set my timer. Do your best to try to remember these 10 words. Give me about 30 more seconds. All right, I'm going to move on. I see a lot of you talking, doing good strategies already. Happy to see it. Okay, so I wanted to start with defining this term cognition. I think it's thrown around a lot now, even more recently. I think we're talking about our brain health and how important cognition is, but what exactly is cognition? So cognition really is our brain's ability to process and learn new information. And within that, there's certain what we call cognitive domains that I'm going to dive a little bit into in this session that are responsible to help us learn that information. So things like our ability to focus or attend to information, our ability to remember information, our ability to kind of problem solve through some things, and then also our ability to speak and understand information. So all of these parts kind of come together to do what we call our thinking skills or our cognition. There's lots of things that can impact our cognition. Some of these things include traumatic brain injury, concussions, cancer and its treatment, age, poor nutrition, lack of exercise. So all of these things, and we'll talk as we go on, of ways to improve our cognition. But also it's important to know that without these things, they can really impact our ability to think and process. So we're going to talk about this as we're rolling through, but again, the importance of understanding this term cognition and all the parts that go along with it. So I know Erin already introduced this term, cancer-related cognitive decline. So this is a new term. What we're all used to hearing is chemo brain. And I almost feel like, and I don't know if you all agree, I almost feel like chemo brain has a little bit of a negative connotation to it. I hear, you know, family members or some of my survivors say, oh, it's just chemo brain. Oh, it's just chemo brain. And it sounds like it's almost belittling the cognitive changes that you're noticing. And it's a serious issue. So I want to move away from that term chemo brain for that reason. But also what we now know through research is that it's not just the chemotherapy that's causing these issues. And as I roll through the presentation, you'll see that there's a lot more components that are involved that can impact our cognition, not just the chemotherapy. And in fact, there's people who haven't even had chemotherapy who are noticing cognitive changes, and they're not really sure why, because it's not chemo brain. So what is cancer-related cognitive decline? So as I roll through, since it's such a mouthful, you'll hear me calling it CRCD. But CRCD is changes in our thinking, right? So these could be very mild changes, which is why they're calling it decline. So as opposed to it being an impairment or a disability, it can be so mild that if you give somebody an objective assessment or you put them through all these different tools to look at their cognition, nothing might show up. But we know that there's a mild change, even though it's subtle, it's enough to impact your everyday functioning, especially for women who are used to multitasking and doing lots of things all the time. You take just the slightest change in your cognition, it can really backfire and really impact your everyday functioning. We know it's caused by cancer and its treatment. And And that probably the most important point that I want to take away is it's not a dementia. And the reason why I want to say that is I feel like I have a lot of patients who are coming in, and it's scary when you feel like you're not thinking the same way you used to anymore, that there is a concern of, is this potentially a dementia, or could this cause a dementia? And what I want to assure you is that what they know in the research is there is no correlation. This is not a dementia, and it is caused by cancer and its treatment, but that doesn't necessarily mean that down the line things are going to get worse at all. So just really important points that I really want to start off with when we're starting to define this term CRCD. So I said there's lots of causes. So as you can see here, here's all the different potential, and I say potential, and we'll talk about why potential, causes for cognitive changes during cancer and its treatment. So one, the immune system activation. So when any issue hits our body, we have an immune response, right? So it causes an increase in these things called cytokines. The cytokines are good because they help us fight things off, but the bad thing about them is that they can cause inflammation. And that inflammation can happen all over, including your brain. So that means just the cancer itself could be causing cognitive changes. We know chemotherapy already, it has a neurotoxic effect. So although its job is to kill the cancer, it can also kill some of the good cells too, including some of the cells in our brain. The stem cell transplant, for some people who maybe have blood disorders, they may be more likely to have stem cell transplant. They notice that there is some correlation between some kind of cognitive changes after stem cell transplantation as well. Immunotherapy, the research is still new because immunotherapy in itself is new, but what they know is that there is some slight correlation between immunotherapy and also some changes in cognition. Radiation, especially if you have any radiation to your brain or closer up to where your spinal cord is, that could potentially cause some issues. Hormone medications. So the hormone medications are meant to stop the estrogen for being produced in our body so we can avoid any reoccurrence. But the problem with that is that estrogen plays a role in brain function. So when we start to decrease the estrogen in our body, then we also are stopping that estrogen from helping certain parts of our brain. Brain metastases, so anytime that cancer can spread to the brain and impact the brain's functioning, that can also cause cognition. And then two big ones, cancer-related fatigue. And I know that you have all, and if you don't know already, there has been a talk by one of our Revital therapists with Unite for her. So I know that Erin will be sharing that link again in case you don't know. But the cancer-related fatigue, if you think about it, right? We know that fatigue is probably one of the #1 symptoms when you're going through cancer and its treatment. When you're tired, it's much harder to think straight, right? So it's much harder to have those same processings going on. And then lastly, stress. So I have yet to come across someone who's had cancer or is going through cancer treatment who doesn't have some level of stress in their life. It's a stressful time. It's hard on family. It's hard on you. It's hard financially if you're dealing with work. There's a lot of stressors that go along with going through cancer and its treatment. So again, it's not just one thing. All of these things work together. And this is why we're saying it's more of a multifactorial issue, not just chemo brain. So again, hopefully you leave this course thinking that, it's something that's serious, it's something that's real, and it's definitely something that can impact your everyday functioning and shouldn't be diminished. And hopefully you feel validated knowing that if you are noticing these difficulties, there's a multitude of reasons why you are noticing these difficulties. So how many people are reporting changes in cognition? So what we know is that 30% before treatment even starts are reporting changes in their cognition. So this could be related to what I talked about before, the immune response. It could be, just the fatigue, if there's any brain tumors or brain metastases, all of those things could potentially be causing cognitive impairments. 75% that's a really high number, is reporting changes during treatment. So during the treatment process, and that makes sense, right? That's when stress is highest. That's when you're feeling your worst. That's when your fatigue is at its worst. You're actively going through treatment, which is causing a higher immune response, can definitely increase that inflammation. So it makes sense that that's where we're seeing the most report of challenges of cognition. And then lastly, 35% are noticing cognitive changes months to years after treatment. So again, not happening with everybody, but 35% are still reporting challenges months to years after their treatment is done. So earlier I had said potential, because not everybody is going to notice cognitive changes, or you might notice them during treatment, but then they fade away after treatment. So what are some predictors that help us see, or potentially red flags that would help us see maybe there could be a higher risk for noticing cognitive impairments? So one, the size of the tumor, how large the tumor is. If it's a brain tumor or brain metastases, we're way more likely to see cognitive changes. Any genetic factors may indicate a higher risk for cognitive changes. Physiological, so higher level of fatigue may cause more likelihood to have cognitive changes. Psychological factors, so if there's any history of depression or current anxiety or stress, these can all indicate or maybe increase your risk of developing issues with cognition. Allostatic load, which basically is your body's wear and tear over time. So the more treatments you've had, the more past history of disease or any other issues you may have had in the past may increase your likelihood of noticing some cognitive changes. And then lastly, lifestyle. So like as we talked about before, exercise, diet, smoking, all these things may increase your risk to notice some cognitive changes as well. So what do survivors report is impacted by cancer-related cognitive dysfunction? So we've talked a lot about what it is, what causes it, but what does that mean as far as everyday life? So this was a study done by women with breast cancer who reported changes in their cognition. And these were the things that they reported that were impacted in their everyday lives. So their self-confidence, social relationships, their ability to function at home, their ability to function at work. And we'll talk a little bit about work as we go through. Your ability to care for your family, your ability to organize your life, and then overall just quality of life is significantly impacted when you notice changes in your cognition. So I wanted to share with you all Joan's story. So Joan is a patient of mine that I had, and I wanted to use a patient example to paint a better picture of what cancer-related cognitive decline can look like. So this particular patient had a history of breast cancer. She was 3 years post. She had a double mastectomy. She had lymph node dissection, and she went through chemotherapy and then also continued on and still was on when I was seeing her 3 years later, an aromatase inhibitor to again reduce that estrogen production. When she came to me, these were some of the things that she said. I come home from work and I go straight to bed. She was a real estate agent and she had 2 teenage boys. So she said, I come home from work, I literally crawl up the stairs and I just go right to sleep. I can't even cook for my kids anymore. I'm exhausted. I constantly get stuck on words. So whenever I'm talking at work, I can't think about what I want to say. It's like the words are stuck. I can't pull them out. I can't get started on anything I need to get done. So she would say, I'd have all these things I have to do, but I just would like stare at my list and I just couldn't get started and I didn't know how to get started. And I keep forgetting what I have to do by the time I'm ready to do it. So she said, when I did try to cook, I would start doing something and then I'd go over to do my next thing and not remember what it is that I was doing. Or I'd go into one room and not remember why I was in that room because I forgot. So these were just some of the challenges that she was reporting. So as we go through, and now that we have a good idea of what this might look like with a patient, I want to kind of talk a little bit about some of these cognitive domains and where you might notice some difficulty. So the American Cancer Society did a recent article, and these are the 5 top areas that were reported as being most impacted after cancer and its treatment. And we're going to dive into these 5 areas as we go through. But attention, word finding, and verbal fluency. So again, we'll talk about that as we go through. Executive functioning, speed of processing, and memory. So let's start with attention. And I always start with attention because attention is the foundation to everything. Without attention, we can't remember things. We can't problem solve if we don't have the information to even focus on, right? So attention can really impact a lot of other areas. And very often, some of my patients think that the difficulty that they're having is memory, but really it might just be attention. And I'm going to share a few examples of why that is. But first, I just want to start with defining what attention is. So it's our ability to focus our awareness on a given stimulus or task. So to be able to focus on one thing, whatever it is that we're doing, whether it's a thing or an activity, to concentrate on it long enough to accomplish what we want to get done. And then also be able to shift our attention from one thing to another when we need to. So earlier I talked about the connection between attention and memory. So one example of this is a lot of my patients say, I can't ever find my keys. I can't ever find my wallet. I can't remember where I put those things. But very often what's happening is attention. Because when you think about it, you walk through the door, you're not paying attention to where am I putting my keys down or where am I putting my phone down? You're thinking, you're shifting your focus to something else, whether it's greeting a loved one, your dog, your family members, thinking about what you have to get going on the stove or whatever it is, or the fact that you're just exhausted. All of these things can impact your attention. So it makes it much harder to know where did I put that thing because you weren't paying attention when you put it down in the first place. So I always tell people when you're putting something down, just say it out loud because all you're doing is you're just helping your brain know where are you putting it. So I have my keys, I'm putting my keys on the table. And also a consistent location is another really good strategy. Just keep things, we know that when our brain gets stuck with procedures, so if I do it the same every time, it makes it much easier to remember. So those are two tips for losing those keys or that wallet or that phone. Speed of processing, another really common reported challenge. Speed of processing is our brain's ability to process or take in information at a certain rate. So some things we can control how they're coming in, other things we can't. So we can't always control how quickly our doctor is speaking when they're giving us a synopsis of what's happening, right? We can't always control how fast that movie is talking or any other information. But if we can control it, that's ideal, but sometimes we can't. So what can happen is when you're trying to keep up, you may lose information along the way. So if that doctor is talking really quick and you miss some information because you didn't get it all in because he was going so fast, that can really be a detriment. So something very common, just how quick the information is coming in, it just takes your brain just a little bit longer to process it the same rate it used to. Memory. So there's 3 general stages of memory. There's the learning and encoding. So taking that information in, then there's the storing it, and then there's the pulling that information back out. And the area which tends to be most impacted with CRCD is the learning and encoding stage. So what that looks like is a thing called working memory. So working memory is our brain's ability to hold on and manipulate information. It's sort of like our mental blackboard. So right now you're using your working memory by holding on to what I'm saying, filtering what's important, and then trying to send it to be stored. I often explain to my patients that working memory as thinking about prior to CRCD, you had a working memory similar to like a conference size table, where you could hold lots of information in a neat, organized way. You could take those different pieces of information and you can manipulate them and you can hold on to them and you can find them and organize them easily. But now, after some challenges with cognition, your working memory may be more similar to like a desk in a classroom. So it doesn't mean that you're not holding on to information. It's just you don't have as much capacity to hold on to the information the same way you used to. So those papers aren't so easy to organize anymore. They're not so easy to find, and things can fall off. So you might remember high priority items, but then you may drop other items. So working memory is probably one of the most common issues that I see with patients with CRCD. And it makes sense when you think about something like going to the grocery store and I know I have to get 5 things, or that list I gave you at the beginning of this presentation, 10 words, maybe only hold on to 5, or maybe go to the grocery store and you only remember 3, but you drop the other 2. So that's a good example of working memory, that your brain's capacity of how much it can hold is less. And when you think about things like fatigue and stress and feeling sick, that's going to shrink in your working memory even more. So it reduces that cognitive load. It reduces how much your brain can hold on to at one time. Executive functioning. I think this is a term that most people are starting to hear a little bit more about. Executive functioning, typically we hear it sometimes related to ADHD. So what executive functioning is sort of, I kind of compare it to like the CEO of our brain. And when you think of a CEO in a company, what do they have to do? They have to organize their different groups underneath them. They have to manage how well they're doing. So our executives have to manage to make sure our memory is doing what it's supposed to, our attention's doing what it's supposed to. The CEOs help problem solve big issues, which is what our executive functions do. They help manage time to make sure we're meeting deadlines. So time management is really important in our executive functioning. They help prioritize what things are most important to get done. They also help with initiation. How are we going to start to get projects going? So initiation is another big one that we start to see difficulty with. It's sort of like, how do I get started on this? So that falls within the realm of executive functioning as well. Word finding. So word finding is our brain's ability to access and retrieve words. So sometimes this can feel like memory. Sometimes people say, you know, I don't remember the name of the hospital, or I don't remember the name of that movie actor. And really, it's not so much memory, it's word finding. So words in our brain are organized similar to a filing cabinet. So if you think about a filing cabinet, our words are organized by files, and files of words that have similar meaning and sound similar are typically organized together in our lexicon. Imagine someone took all those files out, threw them on the ground, and messed them all up, and then put them back. Now you go to find or search in that file, and you can't find it. Now those words are still there, or those files are still there, but now they're not organized and they're not so easy to find. So it's not so much a memory, it's that ability to pull those words out. And this is a good one where I hear people often say, oh, it's just old age. It's just old age. No, it's not old age. It's related to cancer and its treatment. It's impacting your ability to pull those words out. And I have worked with professionals, executives who say, I don't give presentations anymore. Because yes, I can think of another word, but I can't use the same level of vocabulary I used to. I can't express things the same way I used to. That's not, I wouldn't use that word. I can use another one. I can come up with something else, but it's not the same. So it's not just, doesn't mean that you can't not function. It just means you feel like you're not functioning the same way you used to, which can be really devastating. So going back to Joan, Joan had a full cognitive evaluation. And within that evaluation, there's 2 areas that came up for Joan, and they fell within working memory, one of those things we talked about. So that explains why when she was cooking, she would start to do something and then she would shift to her cooking task and can't remember what it was she was just doing. She said, I was holding on to too much information. So I knew I had to put salt in something, but I couldn't remember how many teaspoons I needed, right? So I held on to the salt part, but I dropped the teaspoons. And then also executive function, which explains why she had difficulty initiating, right? So I have all these projects, but I just can't get started. So those were the 2 big areas that came up for Joan. I wanted to take a second to define cognitive reserve. Cognitive reserve is a really important concept because it helps put the power in your hands to improve how your brain functions, right? So it's not that this is it and I just have to live with this. There's ways that you can improve your cognitive reserve. So cognitive reserve is a newer concept in research. What they know is that if you take 2 of the same brain and at autopsy, you look at the brain and the brains both have what we call atrophy. So that means like the brains have shrunk a little bit. And you look back at the people's lives, 2 of the same people, one person who could have had what looked like severe Alzheimer, wasn't able to function, needed 24-hour care, supervision all the time, where the other person was independent. So where's the difference? Why? And what we know is that it's cognitive reserve, that if your cognitive reserve is better, even if your brain gets hit by rough things like that inflammation or that fatigue, it can handle it better. If there's metastases, it can handle it better. So there's ways that we can improve our cognitive reserve, and cognitive reserve is based off of things like education level. Higher level occupations mean that you typically have a higher cognitive reserve. Exercise can help increase your cognitive reserve. New learning can improve your cognitive reserve. Nutrition can improve your cognitive reserve. So these are all things that we can continue to do. Cognitive reserve is not static. We can make our cognitive reserve better. We can make our cognitive reserve worse. So cognitive reserve can work for us if we have a stronger cognitive reserve, but if we have a weaker cognitive reserve, it can work against us. So how can you improve your cognitive reserve and your overall brain health? So exercise, and I know Rita being on the call is very helpful, and she'll tell you firsthand as a physical therapist, there is so much research behind how exercise can improve your brain functioning and your brain health. So if you aren't already working with a physical therapist who's trained in cancer rehab, I really suggest you do. They can create an amazing program for you to help combat some of that fatigue and also help improve your brain functioning and your cognitive reserve. Some opportunities for new learning, which we'll talk a little bit more about in the next slide. Improve your nutrition. So I already know that Unite Her Way has great and wonderful resources for nutrition and ways that you can continue to improve your nutrition. Finding ways to reduce stress. So good research behind mindfulness and meditation. Socialization and engagement is probably one of the highest things I recommend. It's great for your mental health, your emotional health, and your brain health. So find those opportunities to socialize, join support groups, go to lunch with friends, spend time with family. All these things are really important to do to help improve your cognitive reserve and your overall brain health. And then lastly, individualized cognitive therapy, which we'll dive into a little bit more as we roll along. So what do opportunities for new learning? I think that out there in the world, we hear a lot about all these wonderful brain games that are out there, things like Lumosity and CogFit and doing Sudoku and all these things that are good for our brain. And I've even heard people say, well, if I do one Sudoku a day, I'm not going to get dementia. So it's not just doing the same thing every day. It's not just doing brain games every day that are going to help our brain improve or target neuroplasticity. So neuroplasticity helps our brain develop new connections and new neurons. So that we know is going to improve our cognitive reserve. and our ability to function. So what are some things you can do? These are just a few, but anytime you're introducing something new to your brain. So it could be learning a new language. Maybe you've always wanted to learn Italian or Spanish. Duolingo, and there's tons of apps out there, Rosetta Stone, going on YouTube. There's tons of things out there that you can learn a new language, find that opportunity to learn a new language. If you love to cook, you can try a new recipe. Maybe you've always wanted to try to cook duck. Maybe now's your time to try a new recipe, learn a new way to do something. Take a class. There's tons of classes online now ever since the pandemic. If it didn't exist before, it definitely exists now. There is tons of opportunities to take online classes. There's opportunities to go and take classes in person as well. You can take a cooking class. Many community colleges and even high schools offer adult classes. Maybe you want to brush up your Microsoft PowerPoint skills. Maybe you want to get better at using your phone. Take a class. Also check out your local libraries. They often offer classes as well. Learn an instrument. For those of you who like playing instruments, I've had patients who used to play the guitar and they said, I've always wanted to learn to play the drums. So they learned how to play the drums. For me, I'm not an instrument person, so I would never touch one. But for those of you out there who are a little bit more musically inclined, or you don't have to be, it doesn't matter. Again, you're stimulating your brain. You're teaching your brain new information. And congratulations, right now you are all working on your cognitive reserve because you're listening to this presentation. And these speaker series that Unite for Her continues to give you once a month is another opportunity for new learning, which is helping your cognitive reserve. So again, new learning, Sudoku is wonderful, brain games are wonderful, but don't let that be something you do every day and that's the only thing you do. It's all new information, which is going to help our brain continue to improve and function better. So when should I consider cancer rehab? So we've talked a lot about some things that you can do on your own, but if you feel like your cognition is impacting your ability to function in your everyday life, then you should consider cancer rehab. You should consider seeking out maybe a cognitive therapist to assess some of these areas and talk to you a little bit more and provide some strategies and target these areas. And we'll talk a little bit about what that might look like. So what is cognitive therapy? So just to clarify, there's cognitive rehabilitation, and there's also something called cognitive behavioral therapy. Cognitive behavioral therapy is more of a psychological way to address your thinking, and it's related more to emotions, where cognitive rehabilitation is linked more to rehabbing some of these areas that we've been talking about, like memory and attention. So what would it look like? It starts with an evaluation by either a speech language pathologist, which I am a speech language pathologist, or an occupational therapist. They do a full evaluation looking at those areas that we had mentioned earlier in the presentation. And they'll also ask a lot about what's going on with you. What are the functional challenges that you're noticing? How is this impacting you in your everyday life? And then you're going to work together with your therapist to identify an individualized treatment program. So we say individualized, there is no cookie cutter way to address cognitive challenges. So what we're going to do is we're going to figure out exactly where you're having difficulties. We're going to work to develop what we call compensatory strategies. So what can we do to work around some of these areas? And then we'll also work to target these areas specifically. What can we do to improve, let's say, working memory? What can we do to improve our attention? And target some of those things, and then also send you home with some things that you can do to target the areas that you're having specific difficulty with as well. So what can you expect in a cognitive therapy session? As I'd mentioned before, it's individualized, patient-centered functional activities. So we're going to take the things that you're having difficulty with in your everyday life and target those. If you're having difficulty at work, we're going to dive into work. What does work look like? Where are you having difficulties? What can we develop? What strategies can we use to work on those specific areas you're having challenges with? We're going to talk about compensatory strategies like writing things down, using external memory aids, which is a fancy term for using maybe a planner or a calendar, or maybe using some apps on your phone, using alarms, things like that to help you reduce the cognitive load, right? So that's our ultimate goals. What can we do so our brain isn't working so hard? And how can we take some of those things off so it can help us focus on the things that maybe we can't write down or we can't use a strategy for? Participation in cognitively stimulating activities. So once we do that evaluation and we can identify where those challenges are, we can start to target those specific areas with specific cognitive activities. And then lastly, education and training and strategies to support some of those areas that we talked about, like cancer-related fatigue. We can help connect you with physical therapists who can help work and design an exercise program for you, help connect you with psychologists and support groups in order to target some of the distress and some of those other areas that could be exacerbating your cognitive challenges. So Joan went through rehabilitation and she came out feeling significantly better. So she worked with both myself and a physical therapist. We were able to combat her cancer-related fatigue. So the physical therapist worked with her on exercise program. With me, we talked a lot about strategies to combat some of that fatigue, which was a significant help for her. We developed some strategies and we targeted her working memory pretty much every session by doing some drilling activities and helping her use and apply strategies and activities to improve her working memory. And then also helped her use some applications on her phone to support her at work so she could reduce her cognitive load and how much she was holding on to. So some of those real estate agents, the amount of information she was holding on to, like which client, where is she going, when is she doing it. We developed a good system with her to help her organize that information so it wasn't so challenging anymore. So these are some of the quotes she left with. I finally feel back to myself. When I get home from work, I can actually do things now, and I am so much more organized. All right, so before I move on to that last slide, our last slide is going to look at those 10 words that I gave you at the beginning of the session. So what I want you to do is take a second, grab a piece of paper, and let's see how many of those 10 words. So for those of you who joined us late, I apologize. We started our talk with a list of 10 words that we asked people to do their best to try to remember. So go ahead, pull those out if you can, and write down as many as you can remember. All righty. Take a second. How'd you do? I'm sure there's words you're like, oh, how did I forget that one? Right? So I'll tell you on average, most people can remember between 5 to 7. If you remembered more, way to go. 7 is probably a little bit more average. 5 is like low average. But think of some of the things we talked about this presentation, right? So where was your attention when these words went up? Were you focused? Was there distraction happening in the background behind you? Were you wondering about this new girl who's about to talk to us? Where was your focus? Where was your working memory? Did you do pretty good at remembering the first 5, but maybe you dropped the last 5, right? What was your strategy? Did you use any associations? Did you link those words together? Did you come up with maybe a story or a way to remember those words? So this is just a good example of a way to just really look at some of those cognitive domains and how they can impact our everyday functioning. So all of these parts come together to help us problem solve and work through things. And then the one other thing I wanted to share with you, I was talking a lot about compensatory strategies. So something you can do now is reduce your cognitive load. So if you aren't using a planner, if you aren't using any kind of external aid, I would suggest you do, especially if you might not be noticing any cognitive challenges, but if your fatigue level is high, it really can take a toll on your ability to process and think. So something like writing things down using planners and calendars. Now, calendars are great. One thing I would recommend is have something that can come with you. I say that because very often we're out and about, phone rings, especially if you're actively in treatment, doctors are calling you all the time. If someone's calling, you're out and about, or if you're at a doctor's appointment and there's a change in your schedule, if you don't have that with you, it can make it much harder. So now you're holding on to all of that the whole way home. Okay, they said this date, they said this date, does this work? Now let me check my calendar when I get home. So have something that comes along with you. It could be a small little planner, it could be a small little notebook. If you love using your phone, and the reason why I typically encourage phone use instead is because we usually have our phone on us. It's much easier to remember than did I bring that planner. So this one particular app I like, there are so many apps out there, but this app is Google Keep. As you can see, it sort of looks like Post-its, right? So a nice app to use. You can download it for free on your phone. You can use it across multiple devices, computer or laptop. So I know we're about out of time almost, and I want to leave room for questions. This last slide, if you're looking for a cognitive therapist, if you're looking for somebody, we will definitely provide resources. For Vital Cancer Rehab, feel free to reach out to our program. If there's not somebody in your area, we can always do telerehabilitation. So I don't want anyone to feel like you can't get help if you need it. And thank you.
That was wonderful.
Good. I hope I didn't talk too fast, and I hope it wasn't too much information, everybody. I'm sure it was, but that's
No,
okay.
that
You can
was
rewatch
wonderful.
it. That's the beauty of recording, right? You can rewatch it again.
Yeah, that was wonderful. So first, thank you so much. I will not share the few words that I remembered, but in my defense, I was entering people into our chat. So that's where my brain was, Erica.
Your attention was not there. Your attention was not there.
It was not there. Oh my gosh, that was wonderful. So so we definitely have some time for questions. I had some questions come into me that I will start by passing along. So we had one person message. She wanted to know CDK4/6 inhibitors, so medications like Ibrance, can they cause cognitive decline?
Yes. There's not, again, because it's more of a newer medication, there's not enough research to back it up, but I can tell you that I've had other patients who are on it. And given what we know about some of the other medications, there is a likelihood that it could potentially cause some changes in cognition.
Okay. Okay. How about targeted therapy? Does that impact cognition?
So of all of the treatments, targeted therapy is the one that has the least impact on cognition because it's so targeted. But again, inflammation can happen, and all of these other areas. So it's hard to figure out sometimes what's causing what, right? Because of all these multifactorial reasons, it's hard to know, is it this that's causing it? Is it this that's causing it? Or is it the fatigue, the chemo, the inflammation, all of those other things that are causing those difficulties? So it's hard to pinpoint exactly what it is.
Okay, good to know. In terms of treatment, so I had a question come in, and I'll kind of also ask a question on the flip side. So untreated, how many years does chemo brain last on average? And then my follow-up question is, how long is their average treatment regimen for someone that is pursuing treatment for it? Is there an average treatment length, or could that vary person by person? So two questions: how long does chemo brain last untreated? And then how long is an average treatment regimen?
So it varies again, and I think it varies basically because of a lot of the information I talked about. So cognitive reserve can vary. Your overall health might improve. You might get into a better routine with diet and exercise and you notice improvement. So it can vary. Some, as I said, there's some people who months and it's gone. Some people, as soon as treatment's over, it's gone. And then other people, it can be, 5, sometimes longer, 5+ years that they continue to notice changes in their cognition.
Okay. Okay.
And then the treatment part, was that about like cancer treatment or cognitive therapy? Did you mean?
Cognitive therapy. So if someone came to you and wanted treatment, how long might their regimen be?
So typically I would say on average, I see people probably 2 times a week for about 2 months. But sometimes, given people's schedule, I'll see you 1 time a week, or it might vary, see you every other week. So I work with people's schedule. So if I'm seeing you less, then I probably would see you longer. So I might see you like 3-4 months.
Okay.
But yeah.
Okay. This is an interesting question that came in. Irritability and I guess general behavior changes or emotional changes. Does that increase with CRCD? Is that something that we might see?
Absolutely. Absolutely. Yeah. And so I think for a lot of different reasons. One, when you're tired, when you're fatigued, when you're noticing changes in your cognition, when it's harder to hold on to information, you're going to be more irritable. But just the chemical changes in your brain, and the frontal lobe is the part of our brain that inhibits. So that executive functioning I was talking about, that helps us from inhibiting. So we might feel irritable, but what are we doing about it? Are we able to inhibit that response, or are we just spewing? So yeah, absolutely. Irritability and frustration tolerance can definitely change if you're having difficulties with cognition, for sure.
Interesting. Interesting. Okay. We had a couple more questions come in, medication focused, Herceptin, Keytruda. Is there relationships with either one of those medications and cognitive decline? Are you aware?
Not that I don't know if I know offhand which specific medications are typical to cause cognitive decline. And again, because I think it's so hard to pinpoint, but I'm happy I have access to tons of research. So if that's something that someone, Erin, if they want to email or reach out, I'm happy to access that research wise and find out.
Perfect. Yeah. And if you want to share your contact information in the chat, if you're comfortable with that, please feel free to do so. So another interesting question that came into me about non-active disease. So this person has metastatic breast cancer in remission. Could that person still be experiencing CRCD or symptoms of it?
Yeah, absolutely. And so that goes back to where we were talking about seeing issues after treatment is over. Still, you can have side effects if you had chemotherapy. You had, that chemotherapy can have those neurotoxic impact that can cause damage to the brain. Too much inflammation can cause some damage to the brain, and that can sometimes last a little bit, a longer amount of time, which is why we're seeing patients later on continuing to have changes in their cognition.
Okay, wonderful. We had some questions. Melissa, absolutely. We're getting so much positive feedback, Erica, and I'm hearing the validation that I think everyone is hearing that is so important, that, it's not something that they're just making up, or, that just the validation that this is a real, true occurrence that's going on, I think gives everyone sort of a sigh of relief. And anyone is absolutely welcome to share on your Facebook page, social media. Again, we'll have that link in her library. So we can you can share that link, with everyone. And we'll have some additional links from our Vital Cancer Rehab that you can pass along as well. Heather had an interesting question about herbal nutritional supplements that may help. She mentions ginkgo, omega-3s. What do you know about those, Erica? Great question.
Yeah, it's such a great question. I get that question all the time. So as far as if you look in the research, there is no direct correlation between those things and improving brain function. But I think it's so hard to just look at just that. It's hard to like put people in a study and see how they do with one and without the other. So what I tell people is it does not hurt. It definitely does not hurt to take those type of supplements. And I definitely have had patients who've reported that they feel like their brain is functioning better when they are on omega-3s. Ideally, if you can get it in your nutrition, that's even better. So salmon, nuts, that's even better than sometimes taking the supplement themselves. So nothing, again, that like as far as if you take this, this is going to improve your CRCD, but not going to hurt either.
Oh, that's so good to know. Okay. Yeah, that's a really good question. We have a couple more minutes. Erica, are you okay for a couple more minutes for some final questions?
Absolutely.
Okay. And Rita, thank you for chiming in for some of those insurance questions that we're getting. I so appreciate that. How do you know the difference between CRCD and stress and anxiety? How is one able to differentiate if one is one versus the other?
Such a good question. Hard to really tease out. So if I'm finding that I need to tease it out, but sometimes it's just I'm addressing the symptoms. So if you're having difficulty with cognition, I'm going to help you. If your stress and anxiety is causing you to not think straight, well, we're going to address it the same way. But sometimes you also need that extra support, psychological support. So there's neuropsychologists who are trained to be able to give a full battery of assessments to really tease out what's causing what. So they're trained to see specific profiles, they call them, within how you perform on your assessments to be able to see, okay, no, this is more anxiety based. Oh no, this is more cognitive based. But as far as my end, if I'm really questioning it, I would send for a neuropsych evaluation. But again, my ultimate goal is to help you. So whatever is getting in the way, if we can come up with some strategies, we're definitely going to be addressing them regardless.
I love it. I love it. That's so good. Okay, a couple final questions. This was also an interesting question from Crystal. You mentioned talking a little bit about age and my word finding skills are also challenged. Okay, so what she's asking, receiving chemo at a younger age, does that have any impact on how the degree of cognitive decline a patient may experience?
So actually, the younger you are, the less impact you have from cancer and its treatment. However, if you're younger, you may have maybe you have children. Maybe you have, you're back at work. So maybe you're a working mom who is trying to deal with everyday life. So you have a little bit more on your plate per se. So it may hit you harder than maybe somebody who is retired, who, doesn't have as much going on every day in their life as maybe a younger working mom. But if you're, as far as age actually works against your cognitive reserve, not for it. So if the younger you are, the better it is for your cognitive reserve. But if we're talking about children where their brains aren't fully developed yet and they're going through chemo and treatment and radiation, that can have more of an impact on them longer, because it's going to impact or impede their brain development a little bit more.
Mm-hmm. So interesting. So interesting. Yeah, that's a great question. So many great questions coming through. And we'll wrap up.
Wonderful.
I know. We have a wonderful community at Unite for
Yes.
Her. So engaged.
This is the best. Don't tell anybody else as I say this on a recorded series, but this is the best group I've ever had. Such great, wonderful questions. So engaged. It's outstanding. It's really great.
Oh, wonderful. Okay. So medication question. Can medication like Adderall help? That's really interesting.
Yeah, very good question. Absolutely. There are some of my patients who do go on Adderall for sure. So especially if we find that the attention issue is what's causing or the biggest issue with the cognitive impairments or impacting you in your everyday, definitely we have patients on, and we would contact either a neuropsychiatrist or a neurologist who has a good understanding of cancer, so that they can figure out and look at all your medications and make sure that's the right choice for you. But if it's definitely impacting your functioning in your everyday and attention is the major culprit, absolutely. Some people go on even the smallest, most mild dose and they see significant improvement. So yeah, absolutely. Great question.
That is a great question. And I think we covered most of our questions. I know Rita has been actively chiming in with some of the insurance and contact information. And Rita, I'll bring you back on just because I know we have nationwide participants that will be watching or are with us this evening. So if you want to share a little bit, if you know the locations across the country, if those that want to find a cancer, a Revital Cancer Rehab in their area, where could we look for that?
So we have a national, like we have a website, and on that website, actually, there is a location finder.
Okay.
And if you just chime in, you go to that website, maybe I don't know whether everyone has time, but I can even try to pull it up and share the screen and show you the location finder. So.
Okay. And I know you posted the website in the chat, so we have
Yes.
that if you want to just scroll up for sure.
Yes.
And while you're looking for that, I should say.
So there it is.
Oh, perfect.
Go to the location search.
Okay.
And just type in your address. And for example, if I say Downingtown, PA, search locations.
Okay. They can find the different states.
Yep. And I'll come up because I'm the closest. So.
Okay. But they can search that way. And for those that may not have a location in their area, but they may have a rehab center local to them, what would they ask? Who would they ask to speak with? What kind of verbiage should they use? I want to see a speech language pathologist. I want to see a cancer specialist. How would they communicate that?
So based on their need, definitely, if you just say a Revital Cancer Rehab, that's the kind of the name known all across the nation, whether it goes through NovaCare or Kessler, because in my region, it's NovaCare. And we are offering Revital Cancer Rehab. In Erica's region, it is Kessler. It is owned by Select Medical. It is under the umbrella of Select Medical. That would be a term you could use. Specifically, a cognitive rehab, it would be speech and occupational therapist. But then if you're suffering from things like fatigue and weakness and neurotoxicity, a physical therapist can see you. So basically, I would just go to your physician and see if they are associated with any kind of cancer specialist in the area. I would highly recommend going to a cancer specialist, whether you go to us or somebody else. And that is why the reason being that we are very familiar with all the impairments with patients have due to the cancer related treatments.
Okay. Perfect. Okay. So now we have a little bit of direction if anyone wants to look, right? If they don't unfortunately have a location under the Revital umbrella or Kessler, they know where to go or what to say to their physician. This is perfect. Excellent. Wonderful. Okay. I will open it up. Any other final questions? But we are seeing so much positive feedback. I think this has been super helpful overall. Yeah. So many thanks. This is wonderful. Wonderful. All right. Well, I will wrap us up. This was